In 2019, Voice, and I know many of you were involved in this effort, including myself, spoke with over 350 people inside jails, inside our congregations, at addiction support groups, and all had direct experience with the criminal justice system. And one of the things we heard over and over again was the huge numbers of people locked up as a result of mental illness. Many are separated and isolated 23 hours a day. And people who witnessed this said reactions to these conditions were heartbreaking. They heard screams, wailing. It was horrible. And why are there so many with mental illnesses, including addiction, in jail? Well, because during the 60s and all the way through the 80s, the US closed many of the large state mental health hospitals with the promise that they would be replaced with comprehensive, community-based networks of support. This new system, of course, never materialized. And instead, jails and prisons became the new home for people suffering from mental illness and addiction. The closure of these hospitals coincided, not surprisingly, with an explosion in the incarceration rate in our country. The United States has 4% of the world's population, but 25% of the world's imprisoned inmates at a cost of over $1 trillion annually. And the problem is growing. From the Fairfax County Jail alone, there were over 8,200 referrals for mental health services in the first 5 months of 2021, 2 times the previous year. And the number of individuals in need is about to grow exponentially with the implementation of the Marcus Alert System. Because this new state law improves the state's recognition of a mental health crisis and its response to that initial crisis with teams that include mental health professionals.
You just went on mute. Come off of mute there, Peggy.
Okay. When did I go on mute? Let's see.
Just a few seconds ago.
Okay. So but then there's nothing provided in this law after that initial response. So now we'll have even more thousands of people in need and still nowhere to bring them except to jail or maybe a quick stint at the ER. So the question for us is, do people who have a mental illness, including addiction, deserve treatment, or should they go to jail? I'm going to hand this off to Reverend Hoxie for Voice's answer to that question and proposed call to action on this issue.
Thank you so much, Peggy. Voice's proposed response to this issue is the creation of crisis stabilization units, or CSUs. And these are holistic community alternative to psychiatric hospitalization or incarceration, which offers immediate, individualized, and compassionate care around the clock. They are safe, secure, compassionate triage and handoff sites from law enforcement to highly trained mental health and addiction professionals for persons who are having a behavioral health crisis that requires structured observation, intervention, and wraparound social services support overnight or longer rather than incarceration. And they're typically a standalone center with around 16 beds and shorter stay reclining chairs. Police officers spend about 15 minutes or so doing a caring handoff with staff instead of hours in an emergency room waiting for a person to be admitted, transported by the officer to another hospital or mental health facility, incarcerated or released. So what if we had CSUs and supportive programs instead of warehousing people in emergency rooms and jails? Is that a future worth creating? CSUs are powerful tools for tackling mass incarceration and systemic racism. So Voice is well on the way to creating the first ever CSU in Prince William County and is considering creating and expanding centers in Fairfax and Alexandria. So there's opportunity. The General Assembly is meeting in a special session this summer to allocate COVID relief federal funding, and there's interest from top elected officials in using a portion of this money to build these CSUs across the state to deal with the chronic shortage of mental health beds. And so Voice leaders are in the process of putting together a proposal for creating such CSUs. And so this is a huge opportunity for you to help to lead and become involved in this. First, we're going to get together again on July 13th to discuss updates on the campaign, training on listening sessions for persons who would like to publicly share their stories on how they've been impacted by mental health addiction and the criminal justice system, as well as next steps. And second, if our ask around CSUs is acted upon, Voice is going to need on-call teams of leaders willing to go to Richmond on short notice during the summer special session to meet with the elected officials, testify, and keep track of the bill. So we appreciate your taking the time to be with us this evening. A crisis stabilization unit is a win-win for the community, medical facilities, law enforcement agencies, and other stakeholders such as Voice, as we all work together to make Virginia a leader in addressing crisis intervention, lifting up each other in positive ways for positive outcomes. We thank you.